So the view that I have is that the real difference in healthcare is between two world views I call the fortress and the frontier. The fortress is a view that says public policy should have two purposes in healthcare. One is to imagine every terrible thing that could possibly happen in healthcare and to throw every bit of your money and resources and time and effort at preventing all these hypotheticals. And the second is to make sure that anyone who's an insider, be it a doctor, an insurer, a hospital, drug manufacturer, device manufacturer, is somehow insulated from competition from the outside. We want to make sure my students, again, doctors, they'll come at me with two questions. One, how can we get healthcare costs down in this country? And two, how can I make sure my income is safe for the rest of my life? I say, well, you got a problem here in the two questions you're asking. The frontier is a very different view. The frontier is a view that says, if you want innovation, if you want technological change, if you want healthcare to be as innovative in the next 25 years as IT was in the last 25, you got to take some risks. You have to let consumers, patients take risks. You have to let the providers take some risks. And secondly, you can't protect the insiders from outside competition.
So what does the healthcare market look like as a result of Certificate of Need in North Carolina? Here are just a couple of the statistics. We can estimate that there are 12,900 fewer hospital beds in North Carolina as a result of Certificate of Need. We can estimate that there are probably 49 fewer hospitals offering MRI services and 67 fewer hospitals offering CT scans as a result of North Carolina regulating healthcare in the way that it does. So what do we really mean by this? When we first came out with this study, and we've done this in other states, and the thing that's thrown back at us is like we're accusing the state of having a shortage. That somehow we're saying that there are 12,900 beds. There's a shortage of 12,900 fewer beds. That's not exactly what we're saying. What we're saying is that there's 12,900 fewer beds as a result of Certificate of Need. That may sound like a distinction without a difference, but it's important to note we don't know, that is, Thomas and I don't know what the ideal makeup of the healthcare market in North Carolina looks like, or any state for that matter. But it's also important to note that neither do the con regulators. It is impossible, nearly impossible, for a central planner to get all of the information necessary to decide exactly, sort of almost like a master switch or a dial, that they could just sort of turn it to exactly the number of hospital beds. When they find that there's too few, they sort of just release some certificates of need, and when they find there's too many, they just get more restrictive. That's not how it works. The healthcare market, like any other market, is fluid, knowledge is dispersed, and it is impossible for any one person or group of people to determine what that should look like here in North Carolina or anywhere else.